Thank you for joining us for the COVID-19 media call for July 29th. Commissioner Malcolm had a last-minute schedule conflict, so we'll get today's update from MDH Infectious Disease Director Chris Ayersman, and then we'll go straight to questions. So with that, I'll turn it over to Chris.
Thank you, Mike. So to start with the global perspective, today, as of this morning, there were 16.7 million cases and 660,000 deaths globally. And in the United States, we had more than 4.3 million cases and 149,000 deaths. In Minnesota today, we're reporting 52,947 cases. That's up 681 from yesterday. And our median age of cases is remaining low at 36 years old. We added 9 deaths yesterday for a total of 1,589 deaths in Minnesota. 7 of these deaths occurred in residents of long-term care facilities. 3 deaths were in Ramsey County, 2 in Hennepin County, and 1 each in Crow Wing, Sherburne, Stearns, and Washington County. And our total deaths include 3 individuals in their 90s, 2 in their 80s, 3 in their 70s, and 1 in their 50s. And unfortunately, we are continuing to see our hospitalization numbers increase. So we currently have 310 patients hospitalized, with 143 in intensive care. In terms of testing, there were 13,481 total lab tests that were conducted yesterday, which is an increase over the day before. The average growth in testing for the last week was 11.8%, which is the lowest growth rate that we've seen. We continue to see a greater growth in testing compared to cases. So 11.8% increase in testing and a 10.4% increase in new cases. And when we look at the 7-day rolling average of testing positivity, the rate is 4.9%, which is up from 4.7% the week before. One thing I'd like to talk about today is the increase in cases that we're seeing. As I've mentioned in the past, testing is important as a gauge for the spread of COVID. But it's important to keep in mind that it reflects activity and spread 2 weeks or more in the past. So as we're talking about these cases, we recognize that these cases are historical even as we're reporting them to you. And that is why you continue to hear us call for Minnesotans to do the right thing and do their part to slow the spread of COVID. Given that it can be 2 weeks or more between the time when someone is exposed to when they are a confirmed case, we are worried that if we don't take the right steps to limit spread, we will end up like those states that didn't see the COVID train before it ran them over. Weekly average case growth is increasing, and we're concerned about where this is headed. We had 16 more people hospitalized yesterday compared to the day before. We have 310 individuals who are currently hospitalized. 5 more are in intensive care compared to yesterday, for a total of 143 in the ICU. And the last time we had hospitalization and ICU usage this high was a month ago. Another concern is that there were 83 new cases in the long-term care sector yesterday, and that's up from just 40 cases the day before. And it's important to note that 19 of these cases were in residents, but 64, which is a big majority of the cases, were in healthcare workers. This is a concern for us because no matter how hard everyone works to prevent the spread of COVID among residents, there are limits to what we can do from a system standpoint to prevent workers from getting infected and unknowingly bring it into the facilities where they work. This is why you keep hearing me talk about the importance of keeping in mind not only your own perceived risk level, but also the impact that you'll have on others if you get sick. So always consider the many roles that you have in your life. Minnesota's public health system, healthcare providers, long-term care sector, and others are working very hard to prevent COVID from spreading. But we cannot do this on our own. And I often get emails from people saying, you need to make a change. You need to do this. But we can't do this on our own. The ultimate success or failure of this COVID fight is largely in the hands of each and every individual Minnesotan. No one in Minnesota is on the sidelines of the fight. We're all directly involved and have choices to make. Every time you mask up or don't. Every time you observe social distancing or don't. Every time you stay home and separate if you're sick or awaiting a COVID test result or don't. Every time you cover your cough and wash your hands or don't. Every time you choose to do the right thing or to ignore the protective guidance, you are contributing to the solution or to the crisis. I'd also like to provide a brief update on remdesivir. The U.S. Department of Health and Human Services is sending shipments weekly now, so hospitals do know that there will be a regular supply. Some hospitals have fewer doses in stock than others just because of how they have received their shipments in the past and how many cases they've had recently. But we do have a small supply in reserve here at MDH, and we have encouraged hospitals to reach out and contact us if they run out so that we can send them a supply between shipments. There is a new recommendation from the National Institutes of Health that remdesivir be prioritized for patients on oxygen alone and not on ventilators. And Minnesota, just so you know, has received 99 cases since July 10th, on top of the total of 237 cases that were received in May and June. And just for your reference, a case contains 40 vials, and each treatment course is for 6 or 7 vials. So the supply that we've received since July 10th would be sufficient for 660 or 360 treatment courses, depending on what is appropriate. And then I also wanted to provide a quick update on multi-system inflammatory syndrome in children. We are at 15 cases thus far in Minnesota, and the Centers for Disease Control and Prevention is now reporting state data, and we are reporting our data on our website. The demographics that we're seeing for MISC, as it's called, are roughly mirroring what CDC is seeing nationally. Majority of our cases are in Black or Hispanic children in Minnesota. They represent 75% of our cases, and nationally, 70%. A majority of our cases are male, and so in Minnesota, that's 75%, and nationally, it's 55%, and most of our cases are under 10. The average age in Minnesota is 5. We have not seen any MISC-related deaths in Minnesota thus far. Nationally, CDC reports that there have been 6 deaths out of 342 confirmed cases. And all cases except for 2 have tested positive for SARS-CoV-2, the virus that causes COVID-19. The 2 that tested negative had clear epidemiologic links to known cases. There's still a lot that's unknown about this disease, but treatment is generally very successful using IVIG and steroids, similar to what is done for Kawasaki's disease. And with that, I'll turn it back to Mike Schomer for questions.
Thanks, Chris. Operator, we are ready to take questions.
As a reminder, to ask a question, you need to press *1 on your telephone keypad. To withdraw your question, press the # key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Jeremy Olson of the Star Tribune. Your line is open.
Yeah, thanks, Chris. I'm just thinking, I'm not sure which is greater, my desire to get my kids back to school and out of the house or my kids' desire to get out of the house. But either way, with all these indicators going in the wrong direction, I mean, what does the health department think about school reopenings? Do we have a prayer of that happening this fall with the way things are going?
Well, Jeremy, I wonder if many parents are feeling the same way that you are, and their kids as well. Actually, the governor will be making an announcement about that tomorrow, and so I will let him make that announcement. I will say, however, that yes, I mean, one of the reasons that we are so concerned about the rise in case numbers is because we recognize the importance of school and the value of in-person learning if it is safe. And so we would like to see our numbers in a place where all of those options are available. But the governor will be making an announcement tomorrow, and we continue to encourage people to do the right thing so that we can have as much of our opening as is safe, including schools.
And as my follow-up question to that, you mentioned the hospitalizations, and you mentioned before that it's a lagging indicator. Is the blip that we've seen in the last couple of days, does it seem like the tail end of the rising cases, a trend that we're going to see into the future, or is this just a blip, just a bad couple of days? Do you have any reason to suspect one or the other?
In terms of hospitalizations, unfortunately, I think it's going to continue to increase. I think it's just the ripple effect of the cases that we've been seeing earlier in the month. And so that's the concern. We started to see cases, and we were still enjoying lower rates of hospitalization and ICU use. And so I think people thought that perhaps we shouldn't be so concerned about the cases. But as we have feared, we are seeing our hospitalizations begin to increase, and I don't think it's just a blip.
Thank you.
Next question is from the line of Greta Cole of Mintos. Your line is open.
Hi, I've got a question about testing. We're hearing from readers, some of them have tests that are taking a week to get back. My niece got a test and got her results back within 30 hours. Is that a function of where those tests are getting processed? And do you have any sense of the average time it's taken? And then I guess my other question related to that is it a good idea for Minnesotans who maybe want to get a test back sooner to call and ask where tests are getting processed or what the average time is for a given provider?
Certainly, those are all really good questions. Yes, we do know that there have been some significant delays in having tests reported out for people. And it does make a bit of a difference in terms of where the test is processed. So if tests are sent to reference labs nationally, sometimes that can take a very long time to get the results. However, I guess the concern is, and we've heard people saying, oh, I got tested here and it's taking too long. I'm going to go get tested someplace else in hopes that the timing is more rapid. And all that does is just gum up the system. There's a fixed capacity for testing, and so we want people to obviously get their results back as quickly as possible. And we want them to be isolating while they're waiting for those results. But unfortunately, if everybody calls and determines that a particular lab has a shorter turnaround time, the end result will be that will no longer be the case because there will be so many people wanting to get tested. I think it's best that people reach out to their usual provider for testing, but we do recognize that there are definitely some challenges with the timing of testing at this point.
And then I've got another question. In the last few weeks, we've sort of seen the map of where cases are in Minnesota fill in. Over the weekend, Lake of the Woods County got a case. Do we have a sense of whether in some of these more resort-oriented counties, are the cases in those areas coming from community spread, or is it coming from people going up there and spreading it to people in the community and then maybe coming back down and then it's recorded in the Twin Cities?
Well, the cases are identified actually are reported out by the location of residence of the individual. So if there's a case in Lake of the Woods County, that means that the individual who acquired COVID lived in that county. So it's not, we're not looking at where someone may have acquired it when we're reporting out the county. We're reporting out the county of residence.
Right, and I guess my question is, like, places like Beltrami County have seen increases lately. Do we have a sense of whether that's happening through community spread in those places, or is it is it kind of coming up with tourists and just starting to take effect, I guess?
I mean, I think it's fair to say that all of the spread has been brought in from somewhere else initially, but we're seeing COVID, being transmitted across the state. So no portion of the state is immune to it, and so because they're starting to see more cases, it's probably a combination of someone who traveled and was exposed, brought it back, and then it's being transmitted within the community. So in other words, it's not like it's an isolated introduction into the community and then the person has left, and so there's no more issue in the community. We're seeing transmission across the state, and that's why we keep reminding people that no place is really safe from COVID, and the fact that we've seen this in every county now really reinforces.
Thank you. Your next question comes from the line of Bill Werner of Minnesota News Network. Your line is open.
Hi, Chris. Thank you for taking the question. My question is prompted by some comments by Congressman Colin Peterson, who is frankly criticizing Governor Walz's COVID restrictions. He says he's had a number of discussions with the governor about Minnesotans losing business because neighboring North and South Dakota have looser restrictions, and he's advocating for more regionalized restrictions, arguing that the problem is, a big chunk of the problem is in Minneapolis and St. Cloud and other regional centers around Minnesota. Is there any chance that that these restrictions, either for schools or other COVID restrictions, may be approached on a regionalized basis in the near future, or will the increase in cases preclude that, do you think?
Well, certainly, I think that, as I mentioned to the earlier caller, we are seeing COVID across the state. So no area is without activity, and even some areas in greater Minnesota are seeing, high incidence levels because of community outbreaks and things like that. So I just want to reemphasize that disease is occurring across the state, and it's not just in the metro area. And certainly, we do look at things regionally. It's up to the governor to determine how he wants to take the data that we share with him and use that to help inform the decisions that he has to make. So I'm going to defer, any more detail on that to the governor's office. But I will say that, yes, we do look at things regionally, and we recognize that we're seeing spread across the state.
I perhaps did not ask the question fairly, and I apologize for that. Are you giving the governor any specific advice on regionalization? Are you advising him that would not be a good idea at this time, or
well, obviously, I think we've talked about this on prior calls, is that, that this decision making is incredibly complex. And I don't know how it feels for the governor, but certainly even for someone at my level, it can feel like you're damned if you do it, you're damned if you don't. But our job is to provide him with the best public health information and the best epidemiologic data that we can. And we do provide data in different formats and also by region. And then the governor has to take multiple other factors into account in decision making. So our job is to provide data and to help with some of the interpretation of that data. But as I said, there are multiple other factors that go into this very complex decision making. And even with the best information, it is really, it's just challenging to make decisions in a situation like this.
Thanks very much, Chris.
Your next question comes from the line of Catherine Richard of Minnesota Public Radio. Your line is open.
Hi, I was hoping you might be able to say more about the increase in ICU bed capacity is this a function mostly of COVID cases, or is it just really tight because of other patients who might be in the ICU right now?
One of the things that we talked about today as we were discussing this in our briefing was that summer is a time when there is more trauma happening. I think people are out doing things more than they may be at other seasons of the year, and so that certainly is a factor. But we are concerned about the progressive increase that we've seen in COVID cases requiring care in the intensive care unit. So it wasn't that many weeks ago that our cases were just over 100 that were requiring intensive care, and now we're much higher than that. So that is concerning to us because we know that hospitalization is a lagging indicator, which means that it takes a while to catch up to the case numbers, and unfortunately, we are starting to see that catch up.
Okay, and can you talk a little bit about where beds are most scarce? Is it in the cities? Is it elsewhere? And are we getting patients from other parts of the state, other states across state borders transferred to hospitals in Minnesota for ICU care?
Certainly, the metro area tends to be the busiest in terms of intensive care bed usage. And I can't speak to whether or not we're getting, patients from other states. Certainly, some of the high-level care that's provided by medical facilities in Minnesota means that it's likely that we could need to provide care for others because of the high-level care that's available. I don't have that specific information, but certainly I know that our intensive care beds in the metropolitan area are usually very fully utilized, both because of population and because of the types of services available here.
And are you recommending that the governor pull back on electives to kind of relieve some of that pressure?
We're continuing to watch what's happening and, ensure that beds are available, that personal protective equipment is available. We're continuing to watch all of those things and provide the governor with updates as to what we're seeing. Our goal is not to make changes if we don't have to, and that is why I continue to emphasize that it's not about so much what we do, what we say at the top. It's what every individual Minnesotan does in their daily lives. I think that is the most important message to get to people is it's not about executive orders. It's not about mandates. It's about, are you social distancing? Do you wear a mask when it's necessary and appropriate? That's what's going to make a difference for Minnesota.
Okay, thank you.
Once again, to ask a question, please press *1 on your telephone keypad. Your next question is from the line of Jeremy Olson of the Star Tribune. Your line is open.
Chris, thanks for the follow-up. I wanted to ask about that long-term care increase in cases from 40 to 80. Now, total cases increased from 480 to 680, so some of that's just proportional. I'm just wondering if you can put 80 in context. Is that an unusual amount in the last month or so of cases in long-term care? And can you tell me whether that's concentrated in a couple facilities or is that kind of spread around the state?
So good question, Jeremy. The increase in cases we've enjoyed and we've talked about how any day with low numbers we appreciate, and certainly with long-term care we've had a number of weeks where we've had very few cases, 15 to 20 cases each day in staff and residents, and some days even fewer. So that's what we had been seeing, and all of a sudden we're starting to see these big jumps in cases. So it is significant in terms of the last week where we really have seen things in long-term care much more under control. And unfortunately, the cases that we are seeing in healthcare workers, it's not like they're all in a particular facility. They are at multiple facilities across the state. And so that means we now have multiple facilities that have to be addressing COVID because of a potential lone introduction through a healthcare worker.
As a follow-up to that, can you provide a broader perspective on the outbreaks? Is it just bars still? Is it spreading beyond the bars that we were talking about a couple of weeks back? What's kind of the breakdown of that right now?
Yeah, we're continuing to see cases related to bars and restaurants, and we have unfortunately added some new establishments to the list that we're following up on. We have also seen some other, social activities. But the bottom line is that, we're continuing to see more cases in bars and restaurants. So certainly the ones that you've heard about, but we've added many more since that time. The median age overall for these establishments is really folks in their 20s. And there haven't been a lot of differences in terms of the facilities that we have or establishments that we've let the media know about and those that we haven't. But we had 28 establishments that we're looking into. And so, we're continuing to see this as a significant driver for the cases that we have been seeing. And then, of course, it's not just the individual cases, but it's that ongoing ripple effect where we know that people are, working in childcare, working in healthcare. And so that is what concerns us.
Thank you.
Next question is from the line of Catherine Ditchford of Minnesota Public Radio. Your line is open.
Sure. I was hoping to get a quick update on what we're seeing in daycare and other child care settings that have remained open throughout the pandemic. Can you tell us what the numbers are there, what you've seen? Hello?
Sorry, I put myself on mute when you were.
No, that's okay.
I put myself on mute when you were asking.
So just number of locations, yeah, no worries. Number of facilities, number of cases. I think the last time you talked about this was mostly in staff. Is that still the case?
Yes, that's what we've continued to see, and I'm just gonna see if I can pull up those data because we had continued to see that most of the cases were coming in from staff. So maybe what I can do, Catherine, send you the summary when we get done.
Yeah, that would be great. Thank you.
I'm not pulling it up quite as fast as I thought I could.
Operator, we have time for one more question.
Your next question is from the line of Chris Megan from Pioneer Press. Your line is open.
Hi, Chris. I was wondering if you could talk just a little bit about what we know ahead of the announcement on schools tomorrow, just what we know about that age group and how they may spread COVID and just, sort of infection rates. I know that we've seen very few serious cases in the 6 to 19-year-olds, but I was just wondering, some folks have said that younger people aren't quite as likely to spread it, and I'm wondering if there's any truth to that and what else you can tell us about their contagiousness and, how the virus interacts with people in that age group.
Sure. So we, initially, as we've been reporting our cases, you heard about a lot of cases in older individuals initially because, as we talked about, we were focusing our testing on that particular population when we had limited testing capacity. But now, when we look at our distribution by age, we're seeing definitely this skewing to much younger ages. And while the 20 to 29-year-old age group is the largest with 12,569 cases, we are seeing a large number of cases in the 6 to 19 group, which is 6,003 cases. So we're seeing, activity in the younger age groups, which would be considered, school age. In terms of the severity of disease, we see much less severe disease in that population. So of those 6,003 cases, 127 have been in the hospital, 29 have been in intensive care. But, as I talked about earlier on the call, we have had 15 cases of multi-system inflammatory syndrome in children. So while children tend to do much better with COVID, it's not without, some level of severity. So I just want to make sure we're pointing that out. But yes, in general, children do much better with COVID. In terms of transmission, as I mentioned just on the previous question, we do see that, say, in child care settings and things, it's oftentimes the adults that are bringing disease in to the setting, less so children. And certainly when some of the studies from Asia that looked at household transmission, children were more likely to get infected in a household than other settings, and that was more likely to be the source of their exposure was from older family members. But I don't think that we can say that kids, there's no transmission coming from kids or anything like that. We just know that in some of these situations, we're definitely seeing that adults have been, in some cases, the ones that are bringing disease into the setting.
Thank you. Just to follow up real quick, do we know if young people are more likely to be asymptomatic, or is there any truth to that?
I have not heard that. We do know that a large proportion of cases are asymptomatic, and equally concerning is the fact that people are infectious in a pre-symptomatic state. So what that means is in the 48 hours before your symptoms develop, you're infectious, and you may not have symptoms to identify your illness to yourself or to other people. And again, that is why we recommend that masking is so important, because of the fact that you can't always know if someone is infectious or if you yourself are infectious. So I think the important message in terms of asymptomatic, the role of asymptomatics in transmission is just simply the fact that you can't make assumptions about yourself or about other people. And that's why it's really important to follow social distancing guidelines, as well as to wear a mask for source control. And I realize I sound like a broken record on that, but I really cannot overstate how important those things are and how important that is for us in Minnesota to get this under control.
Thank you so much, Chris.
That is all the time we have this afternoon. If you have a follow-up question we were not able to get to during the call, please feel free to reach out to the MDH Communications Office. Have a good day, and we'll be back.
That was state health leaders discussing their ongoing response to COVID-19. We'll have more on this story tonight on WCCO 4 News.